When a patient comes in for a breast augmentation consultation, as plastic surgeons, we get a lot of information as to what the patient is wanting, how much she expects in enhancing the breast, what is the size she is wanting. This is what we can we gather, and of course all the relevant medical information which is necessary to keep the breast augmentation procedure safe. But after the initial breast augmentation consultation, the examination, that's the most important part, and this is exactly what we are interested in this video. And we are going to be showing what all happens during the examination when a patient is seeking breast augmentation. There are a lot of measurements which happen, which are measured when the patient comes in, and we're going to be marking all the important measurements which are required for our calculation of choosing the right breast implant. The first thing what we do is we disrobe the patient. We examine the chest for any gross asymmetries. If there's no any gross asymmetry, we directly go for the markings. Now, the first measurement which I like to take is the base width of the breast. This is nothing but wherever the breast starts taking off from the medial aspect to the lateral aspect of the breast at the level of the nipple is what the base width is. So this is probably the first measurement which I like to take, and that's the base width. So in this particular case, it's around 13.5. So let's say this is the position of the nipple areola, and that's the line along which we measure the base width. So wherever the breast is starting to lift off from here and where it is beginning to end over here, that's the base width, and this determines the width of the implant. And this is the most important measurement which will actually determine what kind of implant the patient is going to have. Now, the second most important measurement is also the sternal notch till the nipple distance. We measure this distance, and this is generally around 20-21 centimeters. We measure this and we mark this particular distance, and the same thing is measured onto the opposite side over here, and this is also marked. And then the inter nipple distance is also marked, and usually the distance between the sternal notch to the nipple on the right side, the sternal notch distance to the left side, and this distance should be equal. It's an equilateral triangle. So this is the second measurement which we take. Now, the third measurement which we take is the stretch of the nipple to the inframammary fold. So we try to catch hold of the nipple, lift it up, and then take the measurement from the stretched nipple till the inframammary fold. Now, this will help us determine what is the tightness in the skin envelope. Now, if the distance is very short, and if the patient wants a bigger implant, we might have to lower this fold. That's the implication of this particular distance. But however, if the distance is too big, we can probably think of accommodating a bigger implant in this particular patient. Now, the other measurements which we take are the skin thickness, the infraclavicular skin thickness. We hold our skin like this and we take the thickness of the skin. Now, if this distance is, let's say, less than 2 centimeters, which means the implant is not going to be covered adequately by the tissue, and thereby we choose to place the implant under the muscle. But if the distance is more than 2 centimeters, if it is more than 2 centimeters, there's going to be an adequate cover for the implant, and we can place the breast implant just behind the breast tissue. So that's another important measurement that we're going to take. Now, the other important measurements are also the elasticity of the skin. We hold the breast tissue and see how much of elasticity is there. This will help in determining what kind of projection the patient can take, whether it's going to be a large projection implant or whether it's going to be a slightly under projected implant. So the tightness on the envelope will determine what kind of projection of implants we can use for this patient. Normally, another measurement which we take when a patient is seeking a breast enhancement is the diameter of the areola. Now, in some patients, it might be very, very wide like this, which is more than 4.2 centimeters in diameter. In these patients, we try to reduce the diameter by removing a portion of the skin and suturing it all across, all around the areola, thereby reducing the size of the areola. So this is very important because we don't want the areola to be overstretched, especially after we put the implant. Now, assuming that the base diameter which we first measured is 12 centimeters, and the woman wants, let's say, a moderate to a high projection. So what we do is, once we get the base diameter, we go back into our catalogs. Let's say I use SEBA implants, and I go into the SEBA catalog and I look at the 12 centimeter base diameter and look at the various numbers. And here is a 12 centimeter implant which we put it, and it's exactly suiting, let's say, the breast, and it is in good proportions. And we also try to see if the projection which is of the implant is actually suiting the patient's requirements. And since we have also taken the skin envelope stretch, we also know that it can accommodate that kind of projection. So it's all marking up the patient and going back to the catalogs of our implant companies, which help us in choosing a right size of implant, and thereby matching the patient's expectations for a breast augmentation.